I've spent almost the last year going from doctor to doctor to doctor about various things, including bowel control problems, diarrhea, constipation. It happens, but I very suddenly last spring had the ability to not go poop for like 2 weeks, which ended up getting me really constipated, which ended up getting me appendicitis, and therefore surgery for an appendectomy. Then, a few months later, I started having urinary problems. I go to the bathroom, great. Get up, go sit in my bed, pee in the bed. Didn't feel like I had to go, just went to the bathroom, peed in the bed. Next morning I get up, I go to the bathroom, I'm standing at the sink washing my hands, pee on the floor. That's weird. A few minutes later, pee on the couch. So I go to the ER at Harborview because, you know what? The Seattle doctors have to know what's wrong with me, so it could be my shunt. Not my shunt. My shunt's fine. They do an MRI, they test me for 15 hours in the ER. I'm there all night. You should see urology. We'll refer you to urology. Okay, great. I'll go to urology. Urology doesn't know what to do with me. They just put me on a medication to make my bladder less active. And then all of a sudden I get a call, oh, we referred you to neurosurgery too. I have not talked to neurosurgery in about 6 years. I don't know why. They just stopped seeing me after my 2018 surgery. They just didn't want to see me every year anymore. I'd been followed up with by a hydrocephalus shunt specialist, and he was just monitoring my VP shunt. But I have other conditions, Syringomyelia, which is cysts in the spinal cord caused by the malformation of my cerebellum sitting too low on my spinal cord. So I go see a neurosurgeon. I talked to him last week. I tell him everything last week. The bowel control, the bladder control, everything that's been happening that I think has been causing me problems, the increased headaches, back issues, back pain, but the back pain's kind of unrelated. He says, okay, well, you're going to have a urine dynamics test next week. So let's see what that says. And then after that, maybe we'll do a shuntogram if the urine dynamics test is abnormal. But I have a feeling it'll be abnormal. I'm like, okay, cool, we'll do that. Fast forward to today when I'm supposed to go to Seattle, 2-hour drive, to have the urine dynamics test. They called me this morning saying, oh, we booked it with a doctor that only sees male patients. So we have to reschedule you with a doctor that sees female patients on January 14th. What? So my neurosurgeon, last I checked, won't even talk to me about other testing until after I've had this test done, which now isn't being done until January 14th. It is now December 4th. I have to wait over a month. I also messaged the neurosurgeon last week, letting him know that I've also had drops in blood pressure. At any time of the day, I could have this moment where I will suddenly get really dizzy and faint, and I just want to lay down, and I feel really hot, and my heart is palpitating, and I've realized this is a drop in blood pressure. It's very sudden. It happens at various times of the day. There's no common theme, and I've been going through this for months, and I've just been ignoring it because I thought, oh, I'm dehydrated. Oh, I need to eat smaller meals, all that. I went to my primary care's office about the drop in blood pressure, and they're like, oh, well, we need to monitor your heart. So next week, I'm supposed to go get a heart monitor put on for 30 days. But you know what? Here's what it really is. I posted on my Syringomyelia Chiari malformation support group page on Facebook, and I said, hey, does anyone have just sudden drops in blood pressure? And also, on a side note, my syrinx is getting bigger, but the surgeons are hesitant to operate. Does anyone have this? Sure enough, a woman comments that her 14-year-old daughter has Syringomyelia, and the Syringomyelia has damaged her autonomic nervous system. The autonomic nervous system controls bowel control, bladder control, heat regulation, blood pressure regulation. It can cause issues with sexual dysfunction. You know what? All these things I've been having issues with, aside from excessive sweating. I have not had that. But maybe I'm not sweating enough. I don't know. It's winter. It's cold in the Pacific Northwest. So I researched this autonomic problem with Syringomyelia, and every symptom matches what I have. So I sent a message to my neurosurgeon. Doesn't respond. I call the hospital today. I tell the receptionist, please send an urgent message that I need to talk to the doctor right now because I cannot wait a month for a test just to have more tests and more tests and more tests. I'm like 99% sure this is what I have. It's Syringomyelia. I don't know if it's operable. I don't know if operating would help. Maybe it wouldn't. But I would like a diagnosis because according to the research I found, finding this out as soon as possible is the best way to remedy it. So, hey, neurosurgeon, can you give me a call?